No, not all rotator cuff tears require surgery. That is, not everything that's broken needs to be fixed, and we know that this is the case because two main reasons. Firstly, as you get older, a lot of people will have completely asymptomatic full thickness rotator cuff tears. So in the 70 age bracket, so septuagenarian age bracket, 20% of people completely asymptomatic full thickness rotator cuff tears. So rotator cuff pathology could properly be viewed as normal age-related pathology in some cases, if there's importantly in the absence of trauma. So that's very important. If you have a traumatic injury and then you have sudden loss of function or sudden onset of pain, that's a completely different scenario. So again, the second main factor is that there are prospective studies looking at operative treatment of rotator cuff tears versus non-operative treatment, and equal outcomes at 1 and 2 years prospectively. So that's reason to be cautious with recommending that everything be fixed in this area. Simple things, avoiding movements that make it worse, in particular abduction with supraspinatus tearing. Simple anti-inflammatories, analgesia, control of sleep with analgesia is very important, so that's become very clear in the last few years of research. Subacromial injections, very effective in some cases where there is impingement-related pain, bursitis or inflammation in the shoulder, and simple closed chain exercises which your physio can arrange. It's a question of how long is a piece of string. It really depends on the level of symptoms the patient's experiencing and whether you've exhausted non-operative treatment. So I would encourage you to wait with non-operative treatment, a proper trial of non-operative treatment for at least 3 to 6 months before considering a surgical opinion.